Vanakkam, Vandanam, Namaste, and a very warm welcome to everybody to our today's exciting webinar organized by the Society of Clinical Research and Medical Professionals, SCRMP Pharmacy Wing. So, this is the second webinar of this series, and myself, Jennifer Milsey, and I'm so thrilled to be a host of this insightful session on roles of hospital pharmacist and ambulatory pharmacy according to the USA standard. So tonight we are going to dive into important topic that bridges pharmaceutical sciences, healthcare relations and the USA. Whether you are a student, a researcher or a future entrepreneur, this session is going to be a game changer. So before diving into it, I just want to tell you an important thing to everybody, all the participants. By the end of the session, feedback form will be shared in this Zoom meeting. Make sure to fill it, please, based on this and your attendance, which are about to be monitored. Your certificates of participation will be provided. And please do not leave the WhatsApp group because through which that we will be providing your certificates. So this is the two things. Stick on to the end and make sure to fill the feedback form. So with no further ado, let's move on. So next slide, please. Thank you. Before diving into the session, let me share a brief introduction about SCRMP. The Society of Clinical Research and Medical Professionals is a registered society based in Telangana, India. It is registered under the Society Act 2001, and SCRMP is dedicated to advancing clinical research and supporting healthcare professionals. Our mission is to boost innovation, education, and collaborations in clinical research, equipping medical professionals with the knowledge and tools to enhance patient care. Through workshops, seminars, and initiatives, we aim to make meaningful contributions to global health and the life science industry. So, next slide, please. Our main aim and objectives are to promote clinical research as a recognized specialty among medical and healthcare professionals, fostering innovations and advancement in the field, to facilitate international collaborations and relation among universities, societies, and professionals, ensuring global opportunities for research, education, and student exchange. Our main objectives include drive excellence through partnerships, global opportunities, and advancements in clinical research and healthcare. Next slide, please. So you are looking on the outer put of our hard work, and there are n number of people working behind this, and with a prestigious moment for me. And I'm like to introduce the dynamic leaders of the SARMP. First one are 𝙎𝙬𝙬𝙬, our national chairperson, Vivek Maheshwari, our national president, Sumaya Bashir Sheikh, national vice president. Next slide. Satyam Yadav, National Vice President, Medha Gayatri, National Vice President. Next slide. A.V. Vasanti, National Vice President, Disha Jain, National Vice President. Next slide. Bharat Anand Raut, National General Secretary, Deepak Kumar Puna, National Joint Secretary, Janhavi Mahesh Katkar, National Joint Secretary. Next slide. Prisha Atul Naidu, National Joint Secretary, Ankit Mukherjee, Director of Strategy and Planning, Mohammed Sheikh Fahad, Director of Strategy and Planning. Next slide, please. Robin Sijo, Director of Strategy and Planning, Dr. Mohammed Misbah, Educational Officer, Hiba, Media Director. Next slide, please. Aritra Biswas, Media Director, P.S. Kritika, Media Director, Deepika, Media Director. Next slide, please. Sneha Chowdhury, Director of Outreach, Akhilesh Madhav, Director of Outreach, Hima Varshini, Liaison Officer. Next slide, please. Khuzai M. Gangadharwala, our Public Health Officer, C.H. Shruti, Public Relations Officer. Next slide, please. Shakilam Shrija, a national coordinator, and A. Money, national coordinator. So these are the passionate individuals driving SCRMP's mission forward. They work day and night in spite of their academic works and their other curricular activities. They keep on pushing extra ideas and hard work into this society to pave way for n number of students and their life to be enlightened. So they give different ideas and they put their hard work into many of these works for you to be utilized. So we really appreciate you if you also a part of SCRMP member. So you might think that what are the benefits do we get from being a SCRMP member? So let me dive into the exclusive benefits of being an SCRMP member. First thing is exclusive member benefits. As a registered SCRMP member, enjoy free journal publications, discounted book publishing, webinar access, magazine coverage, and up to 50% discounts on events and conferences and courses. Accessibility includes join SARMP, state forums, student forum, in decision making bodies, nominate representatives, connect with global leaders, and participate in national and international conferences as a part of prestigious delegations. And you'll be getting opportunity to join corporate events, and SARMP members can join the local organizing committee for prestigious corporate events at no cost, gaining exposure to CROs and or pharmaceutical professionals in luxurious venues. So, career guidance includes SARMP offers assistance with placements, career development, medical writing, scientific publications, and support for admissions to international institutions, enhancing professional growth and global exposure. Next slide, please. You can refer and earn too. So by promoting SERMP's journal at universities outside India, and you can earn about 30% of the revenue. Additionally, earn 30% from paid book publication plans starting at 10,000 INR. So leadership include engage with industry experts via SERMP program, build leadership skill, expand networks, and advance your career in healthcare. Networking includes SERMP provides a platform for networking with medical students, doctors, and professionals from the pharmaceutical and CRO industries. Community drives include participate in SERMP's health awareness campaigns, blood donation drives, and environmental projects, contributing to community well-being and promoting social responsibility in healthcare. Next slide, please. And you can also get internship opportunities. So internships in pharmacovigilance, HEOR, scientific writing, and journals through sign MOUs with CROs, gaining valuable hands-on experience for career advancement. Train the trainer program. So receive academic support for exams like GPT and personal interviews, guidance through SARMP's advocacy team, helping you excel in competitive exams and interviews. So abroad admissions enjoy 30 to 40% discounts on admission fees to foreign universities, providing an affordable path to higher educations and global academic opportunities. So our website coverage includes members' names and profiles will be showcased on the website with special recognition given to team members to their contributions and achievements. Next slide, please. So conference proceedings include SERMP members get their abstracts published in the SERMP conference proceedings, ISSN number, adding credibility to their work. So conference waivings include registered members receive waivers for paid offline conferences and events, reducing cost and enhancing participation. Free access to SERMP event members enjoy the free access to various events including webinars, competitions, conferences, and courses, offering valuable learning and networking opportunities. So members can publish in the official SERMP journal, gaining professional visibility and recognition in their field. Next slide, please. So you might think these are the couple of things which we gain from it as being a part of this SCRMP society, but these are only the outline. You have exclusive benefits, more and more opportunities, and the benefits and the valuable things are out of the range. So this is the outline of SCRMP, and with no further ado, let's move on to today's session. So what's in store for you today? You'll be thinking, right? So today's topic is the role of hospital pharmacist and ambulatory pharmacy according to USA standards. And we have a wonderful, esteemed speaker for us today. And I've heard his speaking earlier, and some of the webinars I've heard him. It was excellent and gives a clear insight about the topics. So let me introduce our esteemed speaker. So he is a distinguished speaker, Dr. Michael J. Freudiger. So a clinical pharmacist and a pharmacy supervisor in St. Agnes Medical Center, California. Style compounding pharmacy specialist and consultant, ASHB and Freudiger Pharmacy Consultant Consulting Compounding and Regulatory Compliance Supervisor, Children's Hospital, Adjunct Professor Clinical in California Health Science Universities, Adjunct Professor in Graduate Institute and School of Pharmacy, Claret, California. He is a registered pharmacist, California State Board of Pharmacy, Nevada State Board of Pharmacy, Advanced Practice Pharmacist, Board Certified Pharmacotherapy Specialist, and a Board Certified Sterile Compounding Pharmacist. He did his BS Genetics and Plant Biology in University of California, Berkeley. Formed at Thomas DeLonge School of Pharmacy and Health Science, University of Pacific, ASHP accredited PGY1 Pharmacy Practice Residency in Veterans Affairs Healthcare System, Lamar, California. So he has 50 plus publications and a number of certification. He is an advisory member of Intravenous and Parenteral Nutrition Experts Network Gulf Region, editorial board member of the Saudi Journal of Clinical Pharmacy, California Health Sciences University, and Valley College. He has been awarded with Stephen C. Philpman Compounding Award 2024, Preceptor of the Year Award 2023 and 2024, Preceptor of Distinction 2016, 2017 and 2018, College Honors 2010, Nathan and Violet David Fellowship Award 2005, University of California College Honor Award 2004. With over a decade of clinical experience, Dr. Freudiger also focuses on clean room design, hazardous drug risk assessment, sterile compounded drug stability, and regulatory policy development. As an adjunct faculty member at multiple institutions, including California Health Science University, Graduate Institute, as I told you earlier, he delivers education in patient care and compounding and ACPA accredited courses both domestically and internationally. His publications and presentations cover compounding, medication safety, IV robotics, chemotherapy, and much more. Dr. Freudiger is committed to advancing pharmaceutical practices through evidence-based strategies, education, and compliance-driven solutions. So this is only a nutshell of him, and so I'm really excited, and I think we all are so much pleased to have him today. And with me, please welcome Dr. Michael Freudiger for today's session. So it will be really appreciated if you show your welcome through the reactions and the emojis which you are given. Welcome, sir.
Thank you so much for the introduction, and nice to meet you all. I'm excited to be here today to talk to you about the experience in hospital pharmacy as well as ambulatory care pharmacy in the United States. And just to give you a broad overview of what each one of these professions and the practices look like. I understand that most of you are students, and I love teaching students. I teach students at multiple universities, and I also teach students in the hospital with me too. So great to be here speaking with you. And let me get my slides going here. So just one moment. Okay. All right, so we'll be talking about the roles of what the pharmacist does in the hospital setting, as well as what is ambulatory care pharmacy and how do we practice that. Can someone give me feedback if you can see the slides okay?
Yes, sir. Yes, you can see your slides.
Okay. So I think this is, there we go. Okay. So first, for the students, I want to talk about what my journey looks like from school all the way through residency and also currently working. So I graduated in 2011 with my Doctor of Pharmacy degree. When I was in school, I was very active. I was a board member of the Students Hospital Pharmacy Society. I also did internships with clinical monitoring at the local hospitals. I also was a lab assistant to help one of the professors, and that was also a lot of my undergraduate work for Bachelor of Science degree too. So I like the lab work, I like the teaching setting, so I continued with that through graduate school. And part of the graduate school in the United States is to have experiences in different pharmacies. Most of them are hospital settings, some will be ambulatory care, and others will be a community-based pharmacy. And we'll receive experience, as you can see listed here, on various settings. We have our simple core rotations, which would be community and ambulatory care and hospital pharmacy, and with the ICU as well. And then we can choose electives. So I liked the pain management and the oncology. And so there I was able to take when I went to be a resident. A resident is a residency is an optional experience that you can apply for, and it's competitive. And once you get it, then you have your core rotations as well as your electives too. So I continued on with additional experience in oncology. And then I also did some specialty clinics and anticoagulation, and everything else is so one of the features that would be at this government-based hospital. So we have our primary care, which is MTM, which is medication therapy management, also going with the ambulatory care setting, which we would see patients over a year-long period and see them in clinic, take the position of the physician or doctor, and write orders, do self-assessments with the patients, and I'll have more slides to talk about that as we go. And then also from after the residency, I started working as a clinical pharmacist. I did a lot of ICU work, was doing much work in emergency medicine, general hospital type of patients, also with oncology as well. And then anticoagulation is always a big part of pharmacy because you have to dose the anticoagulants. Sometimes you have to reverse those. So as a pharmacist, we have to know how to do all that. And I also became a compounding expert, which is the mixing of sterile drugs as well as non-sterile drugs. I have a license in California for the registered pharmacist. That's very common. You'll see that in all 50 states. And then California also has something called an advanced practice pharmacist license. It's a separate license. It allows me to write prescriptions, see patients in the clinical setting, do all the assessments, and usually it's part of a partnership with a physician to go ahead and do that. And then I also have all these other certifications that you see listed, or board certifications. So pharmacotherapy, compounding, and geriatric pharmacist, which I let go because the continuing education is way too much. I also do a lot of consultant work, either in clinics they were not critical. That would all be safe for the pharmacist to do. And there would be a separate section for the pharmacist to then refer the patient to go to the hospital. So they can treat them within their scope of practice only, but after that, they refer them elsewhere. And usually that scope of practice is following the guidelines. And the guidelines would be, which I'll show in the next couple of slides, would be from the American Heart Association, or whoever's writing the lipid guidelines, and also the American Diabetes Association for those. So they're all based on guidelines, which is based on national experts that are writing this. So as long as we follow those protocols, then as a pharmacist, we can continue seeing the patients. But once they fall out of that, like they have diabetic ketoacidosis or very high lipids, which could be causing an embolism somewhere, then we have to send them to the emergency room. We'll also in-office review their labs. We can even order new labs. I had to do that on a regular basis because we want to get monthly labs or every 6 months labs if we're following the cholesterol or the A1C. And then I would make adjustments to their medications based on the review of those labs. So I'd order those. I might increase their medications or decrease. Sometimes you have to decrease if they have muscle pains or change their statin to something else. When it comes to the medication therapy, I would typically have to start them, if they're a brand new diabetes patient, start them on all their new medications, and then give them a lot of counseling on how to manage that now. And of course, some patients, if they're pre-diabetes, they're almost there to actually starting to need the insulin, or maybe start these metformin that could cause some side effects. Patients would like one more chance to start with their diet and exercise. Then I would have to help counsel them on that too. So with the guidelines, these are the major ones that we have in the United States, and they're national. Like even the COPD and the asthma ones are national, and all these guidelines are free on these different websites that you can go to. And there are beautiful diagrams, which I'm going to show you here coming up. And it's just a matter of just following these. And if you have you're the pharmacist with your agreement with the doctor, and you write in there that you follow these guidelines and stay within that, then we are allowed to treat as the pharmacist. With diabetes management, we have the core medications we have to give to a patient to help them long term. We would, of course, give them the medications for their blood sugar. So your metformin, your 𝙦𝙤𝙬, 𝙤𝙤𝙬𝙤, Januvia, sitagliptin, all those types of medications would help with that. But in addition, we have to give some low-dose aspirin because now they have some cardiovascular risk. We also have to give them low-dose ACE inhibitor or an ARB, not for blood pressure really, but for the low dose, if they don't have hypertension, we can give that to give some type of a renal protection. And then, of course, a statin too. And typical dose of a starting dose for atorvastatin is 10 to 20 milligrams. All the other statins have different starting doses depending on their intensity, how they work. So you just have to know those and you dose it. And as you see, we got cholesterol guidelines that tell you the risk factors and based on the age and whatever their LDL and HDL is. And then it just falls down on the diagram to see what you have to do for the treatment. Same thing with the blood pressure guidelines. We can see what our at-risk patients are, of course, if they're combining with other issues like diabetes and they have lower blood pressure goals, and you have to manage that appropriately. So the guidelines will give you the goals you have to shoot for, and then they'll also give you the descriptions of, well, what types of treatment you have to use, and then all goes into your therapy protocols. Doctor signs off on that, and you use these to treat the patient. And then, of course, you write your clinical notes in the computer, just like the doctor would. So that's it's very rewarding to be able to treat patients like this, because you're helping the physicians by being that physician pharmacist or pharmacist specialist. Also, with the patients, you have to counsel them on all their side effects, their drug-drug interactions they might have, drug-food interactions. A lot of people in the US like grapefruit, and that has a 𝙎-𝙬𝙜 P450 interaction with many different drugs that would also be metabolized by CYP450, 3A4. So that could cause some life-threatening interactions if it's going to increase the patient's concentration of their statins as well. So all these you have to educate on. Some drugs cause sun sensitivity, so they have to wear sunscreen or they might get sunburns. And then some patients like alcohol, and alcohol has many interactions with drugs too, so you have to counsel them on that. Give them diabetes education on eating healthy, being active, reducing their risk, and also how to check their blood sugar. When it comes to the checking the blood sugar, some of them may not be able to hold their device correctly or set it up, because they can't hold small things. So you have to teach them how to do that, or get someone else like a caregiver to show them how to do that. But everything goes into this teaching, especially when you have a new person that is brand new to diabetes and just got a new diagnosis for diabetes. How do we do that? Well, we got to talk about the glucose meters. How do we operate it? How do you stick your finger? Where is the best place to stick your finger? On the side or right on the pad of your finger? How to use the test strips, how to use the indicator and cleaning solutions, how to use the insulin pen, or if you don't have the pen, you have to draw it up from the vial. How do you do that? So as pharmacists, you don't think that all these little basics about how you actually have to teach the patient, because you're in the medical field, it's just second nature to you, but to the patient, this is all new. So you have to teach them everything. So how to even keep a blood sugar log. This is helpful so you can see where their blood sugars are different throughout the day, and then how you have to increase their insulin. Same thing with the blood pressure log. Diabetes education, you have to educate on diet and exercise. And this is all on, in the US, we have it's called a MyPlate. I have the link at the bottom too. And you'll get the slides, so you can click on all these links. This is very helpful for the patient education. This is drug interactions with food that are always big issues here in the States. So you get alcohol, your St. John's wort, your leafy vegetables with your anticoagulant warfarins, always an issue. And then patient education with warfarin, that's always big. How to spot bleeding if you're bleeding in your stool or in your gums, large bruises that keep getting bigger. Also, warfarin can have some issues with antibiotics, so they should always be consulting their pharmacist or their doctor every time they start a new antibiotic. So all that is just part of appropriate education when you start these drugs. And you're the expert as the pharmacist. You need to teach the patient to keep them safe. Some of the patients may have the blood pressure issues. When you're in clinic, you have to teach them about how to actually take their blood pressure, and also what is a normal high, what is an unsafe high, and when to call the doctor about that. And there's many different devices. Do they know how to use it? Can they attach the cuff? Do they need help? Can they read the device? Does the device work? So all that should be checked. And whenever you have the patient come in, sometimes patients are too embarrassed to say that they didn't check, or that they can't operate the machine. So you just want to make sure they can actually do it right, and that they're not lying to you. So be welcoming. It's okay to forget to check your blood pressure or to take your medications. They just have to be honest. Take a blood pressure log. This helps adjust the medications too. With inhalers, we also have to make sure that they're actually using their inhaler correctly. There's many different types. I've seen so many different uses that are wrong. You want to look up how to actually give the inhaler, and then watch the patient use it while they're in clinic. And this actually will increase their adherence to it. Now, in California, we have a nice license which helps advance the practice of pharmacy, and they're called Advanced Practice Pharmacists, APH. And this is what the law looks like. So this law recognizes a pharmacist as an advanced practice pharmacist, and they may do all the following. They can perform these patient assessments in the clinic. They can order and interpret the drug therapy related tests. They can refer patients to other
Sir, I think we have done with the question.
Okay, excellent. Okay,
Yes,
all right. Well, nice meeting you all. My best wishes in your career decisions, and I hope that hopefully this was able to help you.
Absolutely, sir. And it's my great pleasure to have you here, sir, because I think, B Farm, PharmD, and Inform also have joined Inform Pharmacology and all. So I will say, sir, it's a great gratitude that you have here and give your expertise on clinical pharmacy and hospital pharmacy. And I'm sure, sir, everyone have learned a lot. Uh, Apart from India, what are the thoughts people have regarding clinical pharmacy outside of India? So that was a great presentation, sir, I will say. And with token of thanks, I'll be sharing the certificate of appreciation just after the session.
Thank you. And once again, thank you so
You
much, guys, for
meet
being in this
everybody.
episode. Thank you, sir. Thank you. And a big shout out to AV Vasanti, our webinar secretary, for organizing in charge of today's webinar, and SCRMP and organizing team for making this event possible. And of course, to all of you, our amazing audience, for enthusiasm, participation, for making this session truly engaging. So before signing off, take a moment to fill out the feedback form shared in the chat box. The form will be available for 7 minutes and you won't get the feedback in the group. So make sure to fill it now. Then don't leave the group immediately from the WhatsApp which you are currently in. Your participation certificates will be provided via the group within 7 working days. Your thoughts help us improve and bring you more valuable sessions in the future. So, with that note, I'm Jennifer signing off. Stay curious, keep learning, and see you in our next webinars. Have a great night ahead. Thank you.